What do I think about self-diagnosis for neurodivergent conditions, things like autism and ADHD, particularly in adults? My name is Dr. Dutton. I'm a board-certified adult psychiatrist. And if you were to have asked me this question 2-3 months ago, I would have given you a different answer than I would now. And the answer I would have given is the predominant perspective amongst mental health and medical providers. And that would be that in most cases, you really need formal neuropsychological testing, definitely for autism and in most cases of ADHD, unless it's like a clear slam dunk diagnosis where there's not a lot of other potential diagnoses contributing and they have kind of textbook symptoms. However, as I have listened to more of your stories and of course been on my own journey of learning more about neurodivergence, I've come to some different conclusions. So first of all, there are a lot of barriers to getting formal neuropsychological testing, whether it's funds, a lot of these are not covered by insurance, whether it's access, maybe there's nothing in your geographic region that offers this type of testing, or maybe it's just time that you can't afford taking a whole day off from work or from taking care of your children to get the formal testing that you would need. So there are cases where it is just not feasible for people. I work in a federally qualified health center. Most of my patients have Medicare or Medicaid, and I have not found a single neuropsychological testing site other than for transitional age youth, like up through age 22, that accepts these insurances. Is it an injustice? Yes, absolutely. Is there much we can do about it right now? Not at the moment. So I can't speak for the neurodivergent community as a whole, but I know that in general, self-diagnosis is something that's pretty accepted. So where do I sit on this now? I think that it is better for you to have an understanding of yourself, whether that means through self-diagnosis, working with a mental health provider who can't officially give you the diagnosis, but thinks that there's likely XYZ going on, or if you are able to get the formal neuropsychological testing. I recognize that having this type of identity can be really helpful for people as far as finding communities that are supportive of them and learning more about themselves, what they need, how to make adjustments to their surroundings, their job, their relationships to better accommodate their needs. And so in these situations, I think that the risk of continuing to try to live life while masking 24/7 are way greater than the potential risks of someone misdiagnosing themselves. Of course, where things get a little trickier are with getting official accommodations or access to disability. These things you typically need formal neuropsychological testing for. For example, I've had patients who are in professional schools. They need to take their LSAT for their law degree or their board exams for their medical degree. And without the formal neuropsychological testing, they will not approve accommodations for your testing site, even if you got them through your schooling from a clinical diagnosis. Additionally, of course, with prescribing medications, we've talked about that there's no real specific medication for autism. Aripiprazole and risperidone are FDA approved for autism. However, this is usually used for safety concerns in people with higher support needs. ADHD, on the other hand, we have a pretty effective treatment, right? Stimulants. And there's a lot of concern about misuse, overprescribing, and diversion, meaning selling these medications for money. So there is reason to be judicious about making an ADHD diagnosis and prescribing these medications. So can self-diagnosis be helpful for people? Absolutely. Is it going to open up access to certain treatments or accommodations that you may need? No. So if you find yourself in that latter boat, I would encourage you to at least see a psychiatrist, because even without formal neuropsychological testing, they should hopefully be able to help with some of these needs as far as accommodations, potentially prescribing. What about you? What's your experience with self-diagnosis? Do you think that this is something that's helpful or harmful? Wishing you all good mental health today, and I'll see you in the next one.